Venkaiah Naidu, sir. The great actor, our superstar, Rajinikanth. Dr. Ravichandran, my friend. Dr. Amit Shah, who has come from Delhi. Mr. Sundar of Sapiens Foundation, and Balaji. And I see a lot of people here, many of dignitaries off the dais, some retired judges have been seen by me. Many people in the audience are having adequate knowledge in the field of hypertension, in the field of diabetes, in the field of kidney disease. But Dr. Ravichandran made it simple for you to understand what is required. It is my pleasure today to join the Sapiens Health Foundation Silver Jubilee celebration, which is being witnessed by all of us. The hard work, the dedication, and the involvement by Dr. Ravichandran had made this Sapiens Foundation to reach its goal of 25 years of completion. The way in which the patients were praising him the day when he started his practice, the day when he learned many things from the nephrologists, from the physicians, how to diagnose clinically many problems, what made him to become a nephrologist, what made him to be a simple person. I am able to grasp many things by his lecture here. Today I am very much happy to get associated with all of you for this function. And I must thank Dr. Ravichandran for giving me this opportunity to be with you. In fact, he had invited me when I was attending some other conference, and he told me that since you are the president of the Indian Society of Hypertension, I request you to be here. I said, I just now handed over charge to the other person, and now I am the immediate past president of the Indian Society of Hypertension. But at the same time, I told him that I was given an opportunity to serve the society they have absorbed me as a vice president of the World Hypertension League. When I informed him, he was too glad to receive this information and requested me to be here. That is why I'm here to share some experiences with respect to hypertension. You know, there are about 5 diseases which are to be considered as non-communicable diseases. One is heart disease, 2 diabetes, 3 hypertension or high blood pressure, the 4th is cancer, the 5th one the kidney disease. If you are able to control, prevent these problems, it is possible to reduce the morbidity and mortality in future. I think the prevention is the key message that one has to adopt to bring down the morbidity and the mortality due to all these non-communicable diseases. In fact, on 9th of March, many of you probably would have come to know that the World Kidney Day was celebrated. When I was asking Dr. Ravichandran, he said it is combined with the Sapiens Foundation as Silver Jubilee celebration. I am really happy that it has combined here. The World Kidney Day theme was that it is a kidney health for all. I think many advertisements had come from various hospitals in the city of Chennai. Many of you would have seen it. The problem is that the kidney diseases cannot be diagnosed quickly. The early diagnosis is usually missed. Most of the people, even in our country, probably reach at the stage when they reach grade 3 or the stage 3 kidney disease. Only then they seek the advice from the physician or the nephrologist. By the time the 1 stage gone, 2nd stage gone, 3rd stage gone. So by the time the patient sees the doctor, probably he had reached 3rd stage or the 4th stage of the kidney disease. One of my professors used to tell, Narasingan, don't worry about these kidney problems. Even the lighter when he was telling, when this kidney problem starts, the person who is affected by this disease got more money, more urine. And when he goes to the other stage, less money, less urine. When he goes to the 3rd or the 4th stage, no urine, no money. And Dr. Ravichandran was telling that 35 lakhs had to be spent by patients for going for renal replacement therapy or the renal transplantation. And you can understand the magnitude of the problem of kidney disease in our country. The role played by hypertension is again very, very simple. When you have hypertension, it is likely to affect kidneys. When you have a kidney disease, it is likely to increase the blood pressure. Linked. Hypertension is very, very important to diagnose very early. In fact, hypertension is a major risk factor for stroke, for heart attack, for heart failure, and kidney failure. But one has to remember that yet another problem that probably everybody is missing, including the doctors, dementia, which is now gaining much importance, forgetfulness. The forgetfulness of the dementia is a problem that can occur as a complication of an uncontrolled hypertension. In fact, the World Hypertension League, it is a non-profit organization that actually comprises about 80 nations. One of the nations which is represented is by India, the Indian Society of Hypertension. An individual cannot become a member of World Hypertension League. Only the associations can become. So one of the associations of the 80 is Indian Society of Hypertension. Our aim is to detect, our aim is to evaluate, our aim is to control the blood pressure in an appropriate manner. Every year, we always have World Hypertension Day, which is celebrated on 17th May. This year, we have chosen a theme, measure your blood pressure accurately, control it, and live longer. That's the message what we are going to spread across the nation, across the globe on World Hypertension Day, which is going to be on 17th May. In fact, there are many things which probably one has to understand. I don't want to take much of your time because the chief guests and the guest of honors are all waiting to address you. But I'll tell you, there are many things which you can probably remember about the control of hypertension, the control of diabetes, the control of cholesterol. I can give you simple tips. Remember 80, a number. If you have 80 milligrams of blood sugar value in the fasting state, good. If you have 80 millimeters of diastolic blood pressure, 120, 80, 80 is the down figure. If it is maintained around that, it's good. If you have a bad cholesterol, LDL cholesterol, if it is maintained around 80 milligrams, good. If you are able to bring down your smoking, stop your smoking, it's good. But I would advise you to go away 80 meters away from smokers so that you can avoid passive smoking. Apart from smoking advice given to all patients, you need to keep 80 meters away from those people who are smoking to avoid a passive smoking. Then the control of your diet, very important. To control hypertension, the salt reduction. In fact, the salt reduction is one of the primary focus of our attention from World Hypertension League. Resolve to save lives. I think it is being represented by our own person, Amit Shah from Delhi. I came to know that only recently. So, resolve to save lives is the motto of World Hypertension League. It was also published in the leading journals. So, we have the representation from International Society of Hypertension. We have representation from WHO. The WHO recommends the global intake of salt by an individual is 10.8 grams. In India, what's recommended is about 5 grams, equal to 2,000 milligrams of sodium. The salt is sodium chloride. Sodium is 2,000, whereas you remember sodium chloride, which we consume normally, should not exceed 5 grams. He has identified all the items which would contain a lot of salt. I don't want to waste your time now by giving you a lot of information about salt content. Salt increases the blood pressure. If you are cutting down the salt intake, it can prevent the onset of hypertension. It can prevent the onset of the kidney disease. Good. So, if you remember this 80, I think that will probably be very valid information, what I thought I should share it with you. If you maintain 80 milligrams of fasting blood sugar, 80 of diastolic blood pressure, 80 milligram of LDL cholesterol, keeping yourself 80 meters away from a fellow who is smoking, and stopping alcohol, reducing the salt, good amount of exercise. If you do all these things, you will live for more than 80 years. I'm sure about it. I'm sure. because you are adopting all preventive strategies. That is most important. And diet. One has to eat to live, and one should not live to eat. That's again another very important message, ladies and gentlemen, that I am trying to share it with you. Obesity. In our country, it is increasing. Nearly about 33.3% of the people are obese. They also have metabolic syndrome, which is actually edging these people to the development of diabetes, high blood pressure, cholesterol problems, heart attack. Without even developing diabetes, they jump into complication of heart attack and die. So the weight has to be reduced. The more you weigh, the sooner you die. Please remember that. The best road to health is to keep ideal body weight. These are certain informations and the tips what I thought I should give it to you on the day when Sapiens Foundation is celebrating the Silver Jubilee. Thank you very much, ladies and gentlemen, for patient listening.